everyone. Good afternoon. Thank you so much for being with us again today. I'm here live in the Springfield office with my Springfield office manager, Michelle. Say hi, Michelle.
Hello. Hi, everybody.
It's so good to see you guys again. You've been really engaged in these Facebook Live meetings with us, and so we are trying to keep these going for you guys on an every other day basis. And today we're going to do more of a question and answer forum because we're providing a lot of information every day about COVID-19, but you guys have some particular questions out there in the field that we haven't really addressed on a case-by-case basis yet. So earlier this morning, we sent out a post and asked you guys to leave us your questions, and we've gotten a really nice response. So we're excited today to address these for you guys because we feel like if there's a group of you who have the same questions, probably the majority of our almost 400 home care aides in the field have the same questions. So Michelle's going to ask me a few questions that came in from the post. I'm going to answer them as fast as I can, but if there's something that we're not able to get to today that you still have an urgent question about, definitely send us a message in our Facebook page, or you can email myself or Michelle directly. So we're going to jump right in. Just a few housekeeping things though. You will be able to receive an in-service credit for being on this training today. So remember to leave your name in the comment section on the Facebook post, or later on in the afternoon, you can go back and watch the video on our YouTube channel and you can leave your name in the comment section there as well. All right, so Michelle, what do you have for me today? What are some of the questions that came in?
So this is some of the stuff that's floating around, Jen.
Okay.
People are asking if you can give them a refresher on what the signs and symptoms of coronavirus are.
Yeah, sure, of course. So we've been hearing this a lot. The most common signs and symptoms of anyone who has been tested positive for COVID-19 are three really simple symptoms you can easily remember: fever, cough, and shortness of breath. So if you're starting to portray any of those symptoms, or you know someone who's starting to portray some of those symptoms, what you should do first is call O'Connell's and let us know. We'll screen you and we'll give you your next action step on what to do based on what sort of symptoms you're reporting to us. So chances are, if you're having those respiratory issues, shortness of breath, pressure on your chest area, and you have a really difficult time breathing, we're likely going to tell you to call your doctor. Depending on the availability of testing in your area and how busy your doctor's office is right now, you could be told to go to the facility and get tested, or you might be told to stay home and self-quarantine. We, of course, at O'Connell's, if you did report to us that you were having symptoms such as fever, cough, and shortness of breath, we would definitely advise you to stay home in an effort to self-quarantine and social distance yourself from the rest of the team here at O'Connell's. But some other things that you can do too, limit your movement in the community. That's not really hard these days since there is a stay-at-home advisory here in Massachusetts. Even on the weekends when we're not working, the
Really
same.
nothing to do.
There's not much to do. Go to the park. Greg and I and the dogs have been doing some really nice hikes in the area. Take brisk walks, go outside, get as much fresh air as you can, but definitely limit your movement in the community when you are symptomatic. Limit your visitors too. I know it's getting nicer out. It's the springtime, Easter's around the corner, and there's a lot of things to be excited about, especially being around family. And it's really hard to distance yourself from nieces and nephews, your grandparents, even your parents if they're in another state. But right now we really all need to do our due diligence in social distancing and protecting ourselves and others. So limit your visitors. Try not to go visit anyone, and be really, really careful of who you let into your house until this state advisory is over. And continue to wash your hands and be really diligent about cleaning surfaces in your house that are frequently touched. We've gone over this a few times. It is definitely worth repeating. The simplest thing you can do to to protect yourself every day is just washing your hands with warm water for 20 seconds. Sing the happy birthday song or the EBCs, but really pay attention to that, because even though you're not in close contact with someone who has it, you could pick it up by touching a surface. And if you touch your face after, you're definitely putting yourself at risk. So if you wash your hands really thoroughly and you keep washing your surfaces with really good cleaning products, then you should be okay. And that's a really easy way for you to keep continuously protecting yourself. And the virus, I guess, also too is worth mentioning about how it's spread. I just mentioned cleaning the surfaces, but the main way it's spreading and spreading quickly and will continue to spread is through person-to-person contact mainly. So someone who is either actively sick with the virus or symptomatic, even those who are asymptomatic can transfer the virus from person to person. So this is why the CDC is recommending that those patients who are sick with the virus, symptomatic, or even asymptomatic, really try to limit their exposure to people and in the community. I know it's a really hard thing to do, even us at O'Connell's. We're all bouncing ideas off each other of how to stay mentally tough through this time and occupied when we don't have a ton of options on the weekends. But we're still here at work. We are in the offices. All 5 of our offices are open. Michelle and I are here in the Springfield office keeping each other company today. We've limited our capacity to 50%. There's only 1 or 2 of us in the offices right now. So we're trying to do our part too, even though we're still open because we are essential personnel. We're still doing our part here at O'Connell's too, to practice social distancing and keeping our areas clean and safe for anyone who might visit. And we want you guys to know you can still come visit us. A lot of our aides have come in to get gloves and hand sanitizer. I don't know what that stockpile is going to look like in a couple of weeks from now. As you know, there's a worldwide shortage right now with PPE, and we're really trying our best to keep on top of that. But definitely give us a call if you guys need to come in for gloves or you have any questions about what's going on. We want to be here as a resource for you. We are still open in all 5 offices, Monday through Friday, 8 to 4:30. So yeah, I think that probably covers it.
I think so. All right, we'll move on to the next question. If a client is already compromised, Jen, how do we truly know they are at risk for the COVID-19 virus?
Okay, yeah, and we actually, we get this question a lot because we service the elderly population in our community, and those are the consumers who are most at risk for COVID-19. And a lot of them already have respiratory issues, whether it's COPD, asthma, maybe lung cancer in the past, pulmonary fibrosis. It wouldn't be uncommon for us to have clients who already have a respiratory issue. What we really want to look for here, and we consulted our nursing team for this question, we want to look for our new symptoms, new respiratory symptoms that you haven't seen with this client, new fever, new cough, anything that's not ordinary for this particular client who has an underlying condition. That's a really big telltale sign that you should watch out for. So if you do start to see those new symptoms, fever, cough, trouble breathing, and it's not something that you've experienced in the past with this particular client, you want to reach out to the nursing team at O'Connell's right away. The nurses will call, they'll screen that client, and they'll direct you on what you should do next. And most chances we're likely going to have you or the client call their PCP right away. And the PCP or whoever their healthcare provider is at the time will direct them on whether they should come in and get tested, or any other further action steps after that. But yeah, I think it's a good question. Definitely just understand your client, be really mindful of their conditions, and really cognizant of anything that changes in their current condition. But yeah, that's
Probably what they want to do at the start of every shift too, just kind of just assess your client really quick before your shift even gets started.
Yeah, I think that's a good point. I think we all could get in the habit of that right now. You guys probably know our nursing team did some calls last week. We reached out to all of our clients to ask how they were doing to make sure they were okay and not symptomatic. And now I think since we're all pretty aware of the symptoms and what to look for, I would definitely recommend you guys doing a screening when you get to the home to make sure everything is okay and nothing's changed from the last time you were there.
Next question. Should the aides or our field staff be wearing a mask?
Yeah, that's a good question. And I feel like not only the home care aides, but people in general just have this question. There's conflicting information out there, but it's pretty clear to us, and the CDC has made it very clear to us that the general public should not be wearing masks at this time. It's really not for healthy people. We want to conserve our stockpile in this country for all PPE equipment, especially masks. People on the front lines, your doctors, your nurses, those providers who are treating COVID-19 infected patients directly should be the ones wearing masks. So if you're healthy and you're visiting clients and neither one of you are symptomatic, it's okay for you to go without a mask. In fact, that is exactly how we are directing our home care aides right now. If you do become symptomatic or the client becomes symptomatic, we will provide you that N95 mask. But right now, when you're out in public, when you're at work and by all accounts really healthy and not symptomatic, you will not need to wear a mask. We really want to make sure that we are keeping an eye on the amount of supplies we hand out to our aides at this early time, because we know that we will likely need that stuff in the future. And so we're gonna really monitor the situations on a case-by-case basis if there was a client or an aide who came down to be symptomatic, and we would hand them out at that time if we felt like it was a situation that warranted you wearing a mask. But right now, we're going to hopefully end that confusion here today, that in all other cases, as you're healthy, masks are not recommended by the CDC or O'Connell's at this time.
Next question would be, a lot of volunteers are currently making 100% cotton masks. Jen, can you speak to the effectiveness on how effective those masks actually are?
Yeah, sure. And I'll add too, O'Connell's is trying to do their part too in making these masks and coming together with volunteers from our team. Even our clients and their family members have come together and reached out about making these cotton masks to help anyone who's out there providing care or possibly at risk of exposure to the disease. And I think it's a really great thing that the community is coming together and everyone's trying to do anything they can to garner resources to make PPE equipment to support our healthcare providers on the front line. What we're doing here at O'Connell's is we're making 100% cotton-based masks for our healthy aides and our healthy consumers who are more or less just in a position where they'd feel more comfortable if their aide in their home or themselves as a client wore a mask, just because of the situation that we're in. I think it's a comfort thing for people to be able to have some sort of protection on their face, even though it's not advised that the public, when they're healthy, be wearing masks unless they're symptomatic. We do recognize that we service a population that is really vulnerable to this disease, and if they would feel more comfortable with an aide wearing a mask, then we would provide these cotton masks as sort of another option for someone who's healthy and not at risk of getting the disease. And so our team is coming together to make these masks. We actually have Melissa and Lysandra in our Westfield office who has volunteered to lead this effort. And if anyone here listening today is interested in coming together as a volunteer to make more of these masks as the week progresses, we can put you in contact with them. But it's not to give anyone any false sense of security. That's definitely not the intention behind making these masks. We're giving them to healthy people when it's requested by a family member. And I promise, from a company's perspective, if someone did have symptoms and there was a situation where an N95 surgical mask was warranted, we would do whatever we had to do to rally around getting those resources for those situations so that they did have the appropriate masks in a situation where they could potentially be at risk. So yeah, I think it's a really great thing. I know a lot of other hospitals in the area are coming together to make more of these masks, and anyone who's interested, we would be more than happy to have more help. And I think in the coming weeks, you'll start to see more people participating and more businesses participating in that as well. So like I said, just reach out and we can direct you to the right person on the O'Connell's team who is managing that effort. So yeah, thanks for the questions. Yeah.
What would you say to someone who has been around someone who tested positive for COVID-19?
Yeah. The first thing I would say is please don't panic. I know that the world is in a state of panic right now, and rightfully so. This is an unprecedented time. It's an unusual place that all of us are living in right now. And I can understand the uncertainty and maybe a little bit of panic behind the situation of finding out a loved one or a coworker or a roommate had possibly been subjected to the virus or even confirmed positive. But I would urge you not to panic. And that's because it doesn't necessarily mean that you're going to contract the virus just because someone you knew had come down with a positive test result. In fact, knowing someone doesn't put you at risk at all. It's your contact with them that puts you at risk. So if you've been in close contact with someone who's tested positive, first, don't panic because it doesn't automatically qualify you for being exposed, but it just means that you want to be really diligent about your symptoms in the coming days. And what's likely going to happen is if you were in very close contact or at risk of also getting the coronavirus because of the person you knew who tested positive, the health professional who tested that person will reach out to you if you are considered a close contact. You're going to get a phone call. I don't know exactly who would be calling you, but I do know that that's the steps that they're taking at the medical facilities for testing. So don't panic. You might not even get a phone call at all. And the reason for that is because you weren't determined to be an eligible close contact. So it's not worth anyone's stress or time worrying or stressing about hearing about someone who came into contact with the virus, because unless you were living with that person as an intimate partner or working very closely with them, you are likely not exposed. And like I said, you will get a phone call if you will, and they'll bring you in for testing if they really feel like you have had significant exposure to it. So don't panic, reach out to us too. We obviously are in really close contact with the CDC and the state departments. We have a lot of information on what to do about testing and symptoms, and we'd be happy to guide you. You could also call 211. That's a new information line that the CDC has put out, and people are using that hourly to get general information about what to do and when they should go get testing. So that's what I would say. Just don't panic. We're living right now, I think, in trying to navigate and find our own sense of calm amidst all the news and the drama around it. And I think we all need to take a step back and breathe a sigh of relief, knowing that 80% of the people who come into contact or contract the virus are going to heal just fine. It's our vulnerable population, like the elderlies that we serve at O'Connell's, that we want to pay really close attention to. And so I just want to also thank you guys out there today watching our home care aides. We have almost 400 of you guys who are still here working and servicing that vulnerable population. And you're doing such a hard job because they're They're the most at-risk population. They're probably the most concerned, and all of our home care aides are doing such an incredible job staying calm, informing them, and keeping an eye out on them to make sure that they stay happy and healthy during this epidemic. So thank you, you guys.
Definitely. Thanks from the bottom of our hearts.
Yeah. We appreciate you guys more than, honestly, you probably realize. I think we have some more questions.
Yeah, some more questions. So there is so much information coming out on a daily basis from so many different news sources. Who should we be listening to, Jen?
Yeah, that's a good one too. I'm sure you guys are all getting alerts on your phones every hour. It seems like there's a press conference every 2 hours from either the president or our state officials, and it's confusing to all of us. But when it comes to anything involving your employment at O'Connell's, or any business related question about your clients or a situation that you're in during your shift as it relates to COVID-19, call O'Connell's or hear and listen to the information that we're delivering on this Facebook page. We are going to continue this channel, and we're trying to be really diligent about giving you guys updates every couple of days. We're really not trying to bombard you because we recognize that you're getting information from a lot of different sources right now, and we want to be here as a relief and a help to you guys. So I would say anything relating to your clients or yourself, your employment, your symptoms, anything you're going through personally that you think could affect your job every day, definitely call O'Connell's or tune in to these live updates that we're going to be doing every day. And I'm pretty sure with those two things, you'll find that you're getting most of the necessary information that you need. When it comes down to what we're in now, like a state advisory or quarantine, a mandated quarantine, that's when you would want to look to your state officials. And that's what we do too here at O'Connell's. We are working in the state of Massachusetts, and we're following Massachusetts regulations as it pertains to doing business during the pandemic, and specifically home care business during the pandemic. So we get a lot of guidance from, of course, the CDC and the World Health Organization, but also the Executive Office of Elder Affairs. So on a local level, as it pertains to your livelihood with quarantines and social distancing, definitely look to Charlie Baker, Marty Walsh. They're pretty aligned during their press conferences. And on a national level, I would urge you to definitely be aware on a national level, but right now all the states are doing something different. So it's probably not worth the stress of keeping afloat of what's happening on a national level, because right now there is no national mandate. I would recommend, if you're trying to navigate the waters of your livelihood in Massachusetts, that you really focus on what Governor Baker is saying and the information that we're sending out to you guys regularly over Facebook and through your Click Here messaging app. So I hope
take a break from that once in a while, right, Jen?
Yeah.
Don't listen to it constantly.
Yeah.
Sometimes you just need a little breather and a little break from all that news. So
yeah, try to
take a walk.
Take a walk. Limit your exposure. The news is on all day right now. Any channel is going to have an update.
It can be a lot to handle.
Yeah, and just be mindful of that. That's such a good point, Michelle. I mean, you want to stay informed, and you want to hear about the evolution of the pandemic, and I think we all feel that way, but we also need to check into ourselves and our mental health and our mindfulness too, and living in it all the time 24/7, it's not going to give us enough clarity in our own lives to keep moving every day and staying motivated for other reasons if we're so engulfed in the news. So, I mean, I'm limiting my exposure to the news to just twice a day, once in the morning and once at night. And I try to turn off my alerts during the day so that I'm not interrupted and my mind's not wandering in that way. So maybe I would suggest that too, if you guys can set some alerts or change your notifications so that you're not getting an alert every time someone's doing a press conference or there's more confirmed cases. It's just going to cause more stress and anxiety. And you guys are doing a really hard job as it is. So anything that you can do to diffuse the stress, the anxiety that you have is something that I know will help with your quality of life during these next few weeks as we start to continue to navigate the pandemic.
All right. Well, we're down to our last question, Jen.
Okay.
Yeah. All right. Would it make sense to temporarily suspend some of the visits to clients who receive housekeeping or companionship services in order to shield those clients and aides from possible contagion?
Okay. So this question, I guess, I'm gonna answer this. It's a really specific question, and it doesn't pertain to all of the clients that we have here at O'Connell's. We put out a message about not closing a couple of days ago and not canceling any shifts because there was an advisory from Governor Baker, and people were starting to get confused as to whether that was applicable to us or not. And so that message was more of a general assurance to our clients alike that we're not shutting our doors tomorrow. We are an essential business. We are staying open. As long as we have clients who are still needing our services, we're going to be here for them, because right now, for the elderly, that is the most important. I've said it many times. I'm going to say it again. They're the most vulnerable population. It's our duty as public servants and healthcare providers, and specifically home care providers, to be here for our elderly during this vulnerable time. And so we're going to continue to do that. And with homemaking and companionship services, we find that as important as any other level of care that you could get at O'Connell's if you're a current client. So right now, I'm not going to get into the specifics of prioritizing, because for the purposes of this position that we're in, it's not relevant right now, because everyone at every level is important to us. And if I could speak to homekeeping and companionship right now and why that's important, it's because cleanliness and hygiene and disinfecting is probably the biggest thing we can do for anybody right now, especially our elderly clients. So if you're on a homemaking shift, keeping those high use areas and those most commonly used surfaces clean is really important to our clients' safety. With companionship even, they need groceries still. Our elderly have a hard time finding someone else in their community to do their grocery shopping for them. It's why we're here, to be that extra person and support in their life that they don't commonly have on a day-to-day basis. So I would just be mindful of the tactical reasons that we're there for support, to keep them clean and healthy, keep their houses clean and healthy, remind them of how to keep themselves safe when we're not there, and using those hand washing precautions so that they understand what they need to do when our aides aren't in their home. And then I would also point to the non-tangible effects of having or not having someone in your home during these times, especially our elderly, who tend to, in isolating times, get a little depressed or unhappy. They start to worry a little bit more. And right now, we really need to be relief for them. And we feel really strongly that continuing to service them and seeing them every day is just one more contact for them to look forward to every day. It's a conversation that they know that they can depend on, even in this time where it's uncertain whether or not they can see family members. We want to continue to be that support system for them, no matter what level of care they're receiving from O'Connell's right now. So I would just remember that their mental health is just as important as their physical safety right now. And we're going to do everything that we can to continue to provide that service for them. And the situation is changing hour by hour, as you guys know. I mean, we are now getting pretty much hourly updates from the state and the CDC. And so it's an evolving situation. Things with the business might evolve down the road. We can't see a crystal ball to try and predict what's going to happen in the next couple of weeks, but what we do know is that we're here today and we can make an impact today. And as long as we're here, we have a purpose, and our purpose is to impact the lives of our elderly. And we are going to continue to do that as much as we can through this pandemic. So if there are any other specific questions about care and services during this time, definitely reach out to the offices until we do another Q&A. But I really liked these questions. I think you guys are on the right track here. I know that you're really retaining and understanding the information, and you're doing an incredible job relaying and executing all of these precautions to your clients. So kudos to you guys. You're doing such a hard job out there. We appreciate it so much. And we really look forward to the next Q&A because these were some really good questions.
Thank you for your involvement in sending those questions in today. It was very appreciated.
Yeah, definitely. So I think we can end there. Drop us a comment in this video if there's anything else you'd like us to urgently address, but we didn't today. And again, call your office because we're here, you guys, and we will be here for the long haul. So tune in on Facebook, keep yourselves engaged. We want to give you the in-service credit that you deserve. So be on the lookout for more in-service dates to come. All right. Thank you, guys. Have a great afternoon and stay safe out there.